Hello everyone, my name is Putri Emilia Dewi with student number 028. So we are from SGD B10, and for the next few minutes we would like to giving some insight into our student project topic in Respiratory System and Disorders block, the pneumoconiosis. Below are our team members, and our presentation will be divided into some sequences: introduction, the contents, mainly including the diagnostic features and management of pneumoconiosis, summary, and the references we use on this paper. So, Indonesia is rich in energy and mineral resources. There are various types of mineral and coal resources in this country. However, it can also harm the health of workers and communities in the environment. It is caused by air pollution due to industrial products processing. Data from the International Labour Organization revealed 250 million cases and 300,000 deaths of occupational disease worldwide. The average incidence of occupational lung disease is about 1 case per 1,000 workers annually. Most of the complaints were pneumoconiosis. So the pneumoconiosis occurs due to the accumulation of dust in the lungs. It causes a tissue reaction to the dust called lung fibrosis. A study from the Global Burden of Disease in 2010 state that the death rate of pneumoconiosis has reached 125,000 people. Workers who are often exposed to mining material thus have a higher tendency to suffer from this disease. Pneumoconiosis can also cause fatal complications such as tuberculosis and lung cancer. An understanding of pneumoconiosis is valuable due to the large number of mining industries in Indonesia. This paper is proposed to improve the knowledge about pneumoconiosis and further increase understanding about it. With a good comprehension, readers can accurately recognize this disease and treat them correctly.
Hello, my name is Christian Rawan, student number 040. Okay, let's just talk about the definition of pneumoconiosis. So, inhalation of organic and non-organic dust and fiber will cause lung disease. This inhaled particle will settle in the lung, causing inflammation and fibrosis. This causes pneumoconiosis to become irreversible lung disease. This disease usually occur in a work environment, so this disease is also known as occupational disease. Pneumoconiosis is the most common occupational disease, especially in developing countries. The type of pneumoconiosis depends on the type of the particle that inhaled. The most common types are asbestosis, silicosis, and coal miner lung. Thank you.
Hello, my name is Mani and the last three digits of my name is 249. Today I'll be talking about the epidemiology of pneumoconiosis. For the prevalence of this case, it has 527,000 cases, and ever since 2017 there's 60,000 new cases. The number of the cases may be higher due to the inadequate report system. For the mortality rate, there's 21,000 deaths since year 2015, and many of the pneumoconiosis cases are not detected in time. Pneumoconiosis has likely a higher rate of morbidity and mortality than previously thought. Thank you so much. That's all from me.
Om Swastiastu, my name is Chokri Sinton Scotty with digit of student number 231, and I'm going to explain about the etiology and risk factors of pneumoconiosis. So pneumoconiosis is the most common occupational disease in the world. The most common causes of pneumoconiosis is exposure to dust in the air that are inhaled into the lungs, such as asbestos fibers, silica, whether it's sand or rock dust, beryllium, talc, and coal dust that usually take place in the workplace. There was an 81.1% increase in the number of cases from 1990 to 2017 for both sexes, but for the age standardized, male had the significance higher in the prevalence rate. So several factors that correlate with the higher risk of pneumoconiosis. It depends on the length of the employment, long-term exposure in the workplace, size and shape of the particles, age increase, and significantly more in male. So asbestosis from asbestos fibers also makes up from most cases in the developed countries, and it also showed that exposure to silica brings the increased risk of the tuberculosis, cancer, and emphysema. Thank you.
My name is Iputika Dharma Mahaputra with NIM 024. Pathophysiology. The main mechanism of pneumoconiosis involve two main mechanisms. The first is chronic inflammation of the lungs and fibrosis. Ingestion of dust particle by alveolar macrophage cause release of inflammatory cytokines. Inflammatory cytokines will attract other inflammatory cells into the alveoli, which will result in initiation of alveolitis and damage to the pulmonary architecture. The next is fibrotic processes. Fibrotic processes occurs following the inflammatory processes. Growth factors stimulate the recruitment and proliferation of type 2 pneumocytes and fibroblasts and induce overproduction of fibronectin and collagen, resulting in the development of fibrosis. Other mechanism in pneumoconiosis is epithelial cell damage. Damaged epithelial cell will release inflammatory cytokines and increase enzyme production.
Hi everyone, my name is Daniel Sumuta Ringo with the student number 045 and I'm going to talk about how to diagnose pneumoconiosis. The diagnosis of pneumoconiosis is usually can be established by history taking or anamnesis and radiologic evidence. From the clinical symptoms, we'll find patients with complaint of shortness of breath, decreased exercise tolerance, gradual onset of a dry cough, or maybe asymptomatic with only an abnormal chest X-ray. All of the symptoms above accompanied by history of harmful dust exposure. Tachypnea and inspiratory crackles may be found on physical exam. Friction rubbing or wheezing may be heard when lung auscultation performed. Pulmonary function tests may indicate a classic restrictive patient with chronic airflow obstruction and decrease in forced vital capacity or FVC. Radiological examination of pneumoconiosis saw widespread opacities in all parts of the lungs, but predominantly in the upper zones of both lungs. Well, that's all that I can tell you. Thank you very much.
Good morning, Doctor and friends. My name is Putri Tamia Desrianti with NIM 081. Differential diagnosis of pneumoconiosis are asbestosis, that is a process of diffuse interstitial fibrosis in the lung as a result of inhalation of asbestos dust. Silicosis is a primary pneumoconiosis involving fibronodular lung disease caused by silica dust. Coal worker pneumoconiosis or black lung disease due to constant exposure and inhalation of coal dust. Hypertrophic osteoarthropathy is a syndrome characterized by finger clubbing, periostititis of long bones, and arthritis. Idiopathic pulmonary fibrosis is a specific form of chronic progressive fibrous interstitial pneumonia of unknown cause. Non-idiopathic interstitial pulmonary fibrosis is a diffuse parenchymal lung disease consisting of a heterogeneous group of disorder with varied clinical, physiological, radiographic presentation. Lung cancer is cancer that starts in the lungs and often found in smokers. Metastatic disease that spreads from its place of origin to other distant parts. TB and miliary tuberculosis caused by Mycobacterium tuberculosis. Chronic obstructive pulmonary disease are symptoms of chronic bronchitis, emphysema, and the classic triad. Sarcoidosis is a multisystem inflammatory disease of unknown etiology, manifesting as non-causating granuloma.
Hello, my name is Putra Ewandari and I'm number 11. So today I will present about the management of pneumoconiosis. Asbestosis, silicosis, and coal workers are the most common forms of pneumoconiosis. Although there is no particular therapy for asbestosis, immunosuppressive agents used for idiopathic pulmonary fibrosis, such as N-acetylcysteine and prednisolone, may be considered in rapidly progressive cases. Supportive care also includes medications for right-sided heart failure and oxygen. There is also no specific treatment for silicosis. In the acute type, therapeutic whole lung lavage has been attempted, but the prognosis is poor. Complications such as right heart failure and coexisting airways illness should be managed conventionally. Prevention includes limiting dust exposure by water spraying using extraction facilities and providing personal protective equipment. Lung function tests and radiography should be used to monitor health of exposed workers. There is also no effective medical treatment for coal worker pneumoconiosis, and concomitant airway obstruction should be treated. And limiting exposure and early identification are important considerations. And the suppression prevention, for example, water spraying and ventilation, should be done. And this should include frequent lung function tests and radiology if necessary. Thank you.
Hello, my name is Jonathan Edmond with student number 137. Right now I'm going to explain about complications of pneumoconiosis. Hemoptysis can occur frequently as a complication of pneumoconiosis. Main causes of hemoptysis are bronchiectasis, bronchitis, and pulmonary tuberculosis. Another complication of pneumoconiosis is pneumothorax. Pneumothorax is associated with pleuritic chest pain, respiratory distress, resting dyspnea, paroxysmal nocturnal dyspnea, and orthopnea. Asbestos exposure is also associated with pleural disease as a complication of hemoptysis. Pleural abnormality can be found with silicosis and non-asbestos pneumoconiosis. Other complications of pneumoconiosis include tuberculosis, autoimmune disease such as sclerosis, SLE, lupus, rheumatoid arthritis, and Sjogren's syndrome. Arthrofibrosis, chronic interstitial pneumonia, and malignancy such as lung cancer and mesothelioma all are also forms of pneumoconiosis complications.
Hello Dr. and friends, my name is Vindra Valentine with student number 086. Since pneumoconiosis was discovered in the 19th century, prevention of occupational disease concentrated primarily on control of the hazard caused by dust. Pneumoconiosis prevention is important because the condition cannot be treated or reversed. Prevention itself classified into primary and secondary. The primary prevention focuses on exposure, surveillance, and control. The most effective way of reducing disease-related morbidity and mortality is to reduce the exposure. The primary prevention itself involves the wearing of a mask, not smoking, cleavage, and the safe removal of dust from clothes. In the meantime, secondary prevention is directed at early disease screening. The early detection of disease must be part of any comprehensive system of preventive medicine to ensure that primary prevention efforts are effectively prevent disease. Thank you.
Good morning, doctor and friends. My name is Shannon Kalista, name 015. Now, I would like to continue the presentation about the prognosis of pneumoconiosis. So, pneumoconiosis is one of the most common occupational disease that will not regress, disappear, or decrease in progression. And the prognosis is poor, especially in the fibrotic phase of disorders. However, it is important to note that not all individuals exposed to inhaled dust will develop lung pathology. Individuals with pneumoconiosis are at higher risk for respiratory morbidity and premature death, or even worse, in the setting of end-stage disease, patients may be candidates for a transplant. There is no effective treatment that can induce regressions of abnormalities or stop the progression of pneumoconiosis. General medical treatment is limited to symptomatic treatment, and the best treatment is to do prevention, which is to avoid further exposure to the inhalant. Although there are many obstacles, it is expected that further study will reveal the mechanism behind pneumoconiosis, help with the development of dust prevention methods, identify new biomarkers, evaluate therapeutic responses, and develop new drugs effective against pneumoconiosis, thus improving prognosis for patients worldwide. That's all from me. Next will be presented by my friend. Thank you.
My name is Pierre. I'll introduce student number 077. So, pneumoconiosis is an irreversible lung disease which is caused by inhalation of foreign objects, which is usually associated with occupation of the patient. Usually, is caused by asbestos and associated with the patient's workplace, which is higher in longer occupational work. And this disease develops by inflammation response of the lung of the patient, which is caused by those mentioned materials. And patients with pneumoconiosis have issues that are similar to patients suffering from COPD, bronchitis, or emphysema, such as shortness of breath, lower vital lung volume, and dry cough. In a radiographic examination, the patient will appear to have widespread opacity, which scatter all around the patient's lung. There is some other differential diagnosis, which are asbestosis, silicosis, co-worker pneumoconiosis, and hypertrophic osteoarthropathy. The management of this disease we can use is immunosuppressive agents with supportive care And we can prevent this disease by filtering the workplace of the patient. And we can also limiting the exposure of the aforementioned materials. And patients with pneumoconiosis can have some complication like hemoptysis and pneumothorax. The prognosis of the patient is bad, which means this disease will not regress or disappear. And patients with pneumoconiosis will be at high risk for any other respiratory diseases.